Hello, everybody. Thank you so much for coming back to our third episode of Tea with Terry. I am so excited to introduce our next guest. Without further ado, let me let you introduce yourself because you actually are amazing. I think you're amazing.
Oh, this is my young man I've known forever. He was one of our young people at Horizons and Center on Halstead, so got to watch him grow up into the most amazing young person. My name is Jill Dispenza, and I worked at the Center on Halstead for 20 years, and I helped with my teams build all the HIV programs there. When we went from Horizons to Center on Halstead, there wasn't any HIV services but the hotline.
Right.
And so the state of Illinois' HIV STD hotline. And so there was no testing, there was no PrEP navigation, there was no linkage to care, there wasn't anything. And we got a grant a year after we opened, and we opened in 2007. So 2008, we got a grant and said, start, get going. So I had to build something from that didn't exist. And then very effective, lots of people helped, and we learned an immense amount from the folks that interacted with us, our clients. And then just this January, I moved from the center and started working at Northwestern University and in their offices downtown where their research happens. So the Institute for Sexual and Gender Minority Health, which we call ISGEM, because it's a lot, and also the Third Coast Center for AIDS Research and the AIDS Clinical Trials Group, which is working on a pathway to cure. So they hired me to be involved to engage community because I had done that my whole career, and they're smart, sweet PhDs and doctors who don't know especially how to interact. They want to. They're very nice people and they're very excited, but they're a little shy. So Brian Mistansky was like, can you come over and help us just engage with community? Because they're known nationally and internationally for their research, but we don't know it in their own backyard. So they were like, oh, we got to fix that.
Wow. First of all, for you all who don't know Jill has known me since I was like yay high. And it's interesting because I'm a community engagement specialist in my role right now. So I always relate that back to when I first started coming to Horizons and then Center on Halstead, and my interactions with like the first staff, like set of staff members there, and how welcoming they made me feel, or just like, providing this space. And I think that that's so important when we have conversations about like HIV prevention and like, just like even and getting to zero initiative. And I kind of want to go back to that world, and like how was it when you were first starting to get into like HIV prevention? And like, I'm not talking about Center on Halstead Horizon, but when you first started, like, how was that, and like to see all of that and then see where you are now, what does that do when we talk about speaking to that, getting to zero agenda or initiative?
That's a really good question. I started being aware and involved in the 80s. I was living in New York City in the mid 80s. Crack, HIV was popping everywhere. Some very, very close friends died from it before there was medicine, before anybody even quite knew what was going on. People were afraid. They didn't know how it was being transmitted. They weren't even sure what it was. So it was kind of like the beginning of COVID, almost like nobody knew what was happening. And then, of course, people then get blamed because it was assumed that it was, sex workers, drug users, LGBTQ folks were putting this on the world, And then I moved to Memphis, Tennessee, and then I had a friend who was living with HIV and helped her, So it was kind of just knowing folks. And then when I moved to Chicago many years ago, I played the bassoon, so I was playing in orchestras and stuff, and then I met the CEO of Center on Halsted, Tico Valle, and he was like, come be a part-time receptionist for me. So that's how I started at Horizons. It was a part-time receptionist, which people like to hear that because I became a director at the center, but I started from the bottom and I was fine. I had impact in that role, welcomed people, made sure I used pronouns correctly, and made sure that people were getting seen. So you can work your way up.
I think that that's so important though, too, because one, I think that I am always harping on community, what makes community feel safe, and how do we reach people? And seeing somebody I know who I felt safe with, just talking to, literally leading the direction on how one of the largest institutions recruits their research, that's power. That says so much to me. And I think that's why I wanted you to talk about it too, because I think that a lot of times I forget a lot of the power I hold, in my voice. And I think that sometimes it is people like you who remind me and things like that. And I think that I often sometimes think I'm really small in this work sometimes, but I think that getting to zero takes everybody, every little voice, or even the people who don't want to be seen and doing the work. I think that there's some stuff that I've experienced when it comes to just my seroconversion with HIV that I'm making my peace with. But I wanted to talk to you more about policy and then actually getting to community and what does that mean. So when you hear people talk about this initiative getting to zero, and you think about your experience and just engaging with the staff that you've worked with and trained over the years, because I think that I want to talk more about that too and the uniqueness there, but also the community. What are some things that comes to your mind when you hear someone say we need to get to zero? We got to get there by 2040.
Yeah. I mean, it's interesting the way you phrased the question, because I hadn't until now thought. I knew it was important. I trained hundreds and hundreds of people throughout my career, young people who came in, who wanted to learn, and every single person we sent out knew more about LGBTQ folks, people living with HIV, what they needed, how to help them. So they became better wherever they went for the world. Somebody at the health department, Chicago Department of Public Health, said they would do site visits, and everywhere they went in the city, they ran into people that I had that were on my staff at some point. And they said, "You totally feed public health. You've been feeding public health for a long time," which is a way to get to zero, right? If you treat your staff with respect, you feed their giant brains and answer their curiosity. But also in our community, you also have to make sure that they are, because they're part of the community we serve. They're not just the server of the community, they're part of it. So it's a challenge because they also have a job to do, right?
Right.
But getting to zero, when I first started hearing about it, I was super excited. I was like, oh my God, it makes me want to cry almost, because to be old enough to be at the beginning of it, and to literally, I've always said, I want to work myself out of a job so that we no longer have to have, and I can worry about chlamydia or something else, let's talk about your syphilis. But to think to see that nightmare in the beginning, and to think that young people never have to worry about this again is just incredibly moving to me. And I was at the right moment in my age where that was happening. I think, but it scares me too, because we still have the same challenges with racism, with evictions, with people not getting paid for the work that they're doing fully. There's so many challenges that are bigger, no matter how much public health cares. And then I'm like, we can't get to zero unless everybody gets to zero together, which is a functional zero, right?
Right.
We're probably not going to eradicate HIV, but we can get to the point where it's not going to keep traveling.
Exactly, especially at the rates that we've seen in like history,
Yeah.
in the communities that we've seen it like ravage through. I really appreciate you saying it's really important to understand that like we are hiring like people from community. I think that that is not also a part of this initiative of getting to zero. It speaks to some of those unique nuances. And
Mm.
like, I want you to speak more about like, what is it like being in a space of hiring someone from community, and how is that so different from someone fresh out of like college, and
Mm.
they went to school for public health and they went and got their masters and now they're here.
Yeah. That's a really good question because I've done both. I've had many
Right.
of both of those folks. What I found, nobody's going to be watching this, right? What I found is that often the folks that were coming in from college, sometimes they're amazing because of who they are, because of their heart and their desire to learn and take feedback. Sometimes, though, they were more problematic than anybody that you would assume somebody from community would be. The people from community, I had a staff member who had a 6th grade education, and he found out in a really bad way many years ago that he was positive, back when they would just write it on a piece of paper and stick it in your face and go, get your affairs in order. And what does a 20-year-old know? They're like, my affairs, what does that mean, get my affairs in order? Yeah. So the folks I hired often had an intrinsic motivation inside themselves for doing the work, because it's really hard work, as you know.
Yeah.
But they wanted to make things better, one by one, to everybody that they interacted with, and they did. It was and I also learned when hiring folks to be. Sometimes people spin when they hire. Oh, we do this, and you can do that, and then I try to be ragingly honest about it, because some people would go, oh, my ex-employer, they didn't really support my educational desires. And I said, okay, what does that mean to you? Because we may not either.
Right.
Because we didn't pay people some kind of, stipend for their education. I'm like, or, we weren't super flexible in the schedule either. And I was like, we might not be the right place for you. So I always I almost made it sound worse than it was, because I really wanted them, as much as possible, to know what they were walking into.
Yeah, I think it's that honesty too that I've always appreciated with you. And like, I think that that's something that is thought that is so, I think that's something that people think they do a really good job at doing. And oftentimes it is more so placating to people because you still want to be liked. And I've never gotten that from you, and I think that's one of the greatest parts about the work that you do. I think that I want to go back to something interesting that I've just kind of like gone through. I started in this work passing out condoms in Boys Town as part of Prodigies of Pride, and
I remember that.
I think that I love that type of work. I loved all the job trainings. Like, I needed the money, but I can always. I remember when I first started as a health educator, leaning back on all of that training around professionalism, around understanding HIV. So like, I think that like that was such an like integral part of like how I got into this work and why I knew so much when I got into this work. I think that the complex, unique situation I ran into was this space of degrees meaning so much in this work. And, I am a person that's back in school right now, pursuing my degree, but I have seen it be somewhere this really debilitating thing where I've seen there are some people who coast through and never get it and they are fine. And I have also seen it where someone will get into an agency, become an HIV tester, think everything is great, and then that grant is gone.
That's right. That's definitely our work.
And I think that what I have tried to learn more is how do we have more conversations about well, we want to make sure that we like give you a phlebotomist skill. And how do you feel about those type of conversations, or like what are your thoughts around like situations like that?
I know the center on Halstead years ago, they had degrees on there, right?
Mm-hmm.
And I said, this was years ago, I said, you're asking for degrees. I'm trying to hire people living with HIV because of their lived experience, and their input makes our program better. They're our focus group. My staff is my focus group. They're the ones telling me things, right, that I need to know. But I said to the CEO, these are folks that would have been going to college, early 20s, late teens. They found out they were HIV positive at a time when they thought their life was over. So they didn't go to college because they didn't know they were going to live.
Yeah.
And so I said, you're cutting out people that are really important. And he understood that. But and I said, but these folks they have the lived experience, but not everybody, but not the college degree, because they didn't know they were going to live. And so they were getting their affairs in order, right? So we ended up putting in whatever degree sometimes there's no choice. If it's a therapist, they have to have that degree and that license. But for the work we were doing, no, they just need a certificate. And I said, can we put experience in there? And what I found when I worked with AIDS Foundation for the HIV hub was the people I hired, the people that did the best had customer service experience.
Yeah.
Which when I was hiring for the testing program, they needed to know a lot more about HIV and other things. But for the hub, they know that. They learned that from us. But they really needed customer service experience because they had to be organized. They had to be polite, even if somebody was upset. Like they had to keep pushing forward. And that turned to be a workforce I wasn't as familiar with, but turned out great.
Yeah, I will say a lot of my customer service experience in the years of working at like Potbellies or something, it's been easily transferable to like, how do you deal with a client that's upset, de-escalation, so many transferable skills that I think I think the funding for these programs are super important. Like whenever we can get funding for youth spaces that can provide it, I think that's huge. I come from a generation where LGBT youth spaces had breakfast clubs for adults. Like I remember they had Job Corps clubs. Like there was stuff to do at the. I remember it being a time where there was something to do at Center Hostel Youth Space from the minute like 9:00 in the morning till 7:00 in the evening. And I think that also did so much more. We talk about getting to zero, because I was coming to the space and not knowing anything outside of, I had an uncle who died of HIV complications, and nobody in my family wanted to talk about it. So to be in a space to act, I wasn't talking about the type of sex I was having, or it was just so many other things. And I think I'm saying all this to say, because I want to talk about policy now, and I want to talk about like what we are seeing in our country a lot of time is a lot of reform in policies, where policies are being gutted, money is being lost to really detrimental programs. And I thank God a lot of times that I live in a state like Illinois, because we have so many resources. Like ADAP is something that is incredible. For you all who don't know what ADAP is, it is a Illinois service that pays for your HIV medication if you do not have any type of insurance. And even if you are on Medicaid, you can still be on ADAP. It's like one paid versus the other, but
it does pay, even if you have insurance, it'll pay your co-pays. It'll pay even, I get confused by insurance, but the money you pay monthly into it, it'll pay that if you live with it. So it depends on income and things, but because it's cheaper for them to just pay your copay than to have somebody, then they have to pay it all.
Right.
So they work with it. They've been very, very good. They're great with young people. If a young person can't, like they're on their parents' insurance, usually you have to use that insurance. But because ADAP, which is the AIDS Drug Assistance Program, because they cared so much about the LGBTQ community and understood that kids couldn't first they would be coming out maybe as gay, and then they would be coming out as positive to their parents, they can get a waiver. And then they don't have to use their parents' insurance at all. They just take care of it, do that.
And that's something that not only speaks to like, that's just, for me, I think that like that speaks to like policy understanding, community understanding, people understanding culture. And I wanted to talk about policies because I was interested to see overall, has there any policy changes or things that you've noticed in the last couple years that would halt something like getting to zero? And it doesn't have to necessarily be here in Illinois, but just in general.
Well, the funding definitely isn't following the epidemic, where it's generally, let alone specific populations that are most impacted. And every single law in the United States that goes after people of color, that goes after LGBTQ folks, especially trans, people of trans experience, not only does that scare them and make them not want to interact with any kind of medical or any other kind of system, but it also injures them horribly mentally, to the fact where they don't feel like they need to take care of themselves, because that's why many things are higher in our community, right? Drug use and mental health issues. And people outside of our community are like, oh, it's because there's something wrong with you. And it's like, no, you're doing this to us. This is a direct result from your legislation, your hateful legislation that's abusive and the vilifying of a population. You know, trans people are not in bathrooms bothering anybody. Like, it's just not a thing. You know, I think that those kind of things, people don't think about the impact that they're having. Years and years ago, when President Obama supported gay marriage, I wrote him on the website and just thanked him and said, I know this was politically difficult. You have no idea how excited people in this building are at the center that the president finally said, you know, that gay marriage was okay. And he wrote me back. By the way, I have a letter. One day I'm going to get him to sign it. But it was beautiful, and it was a response to what I wrote. So he really did read what I wrote.
That's incredible.
Yeah, I have it on my wall at work. It's amazing. But there's the good in somebody like that who changed over time, you know, and we were just, as a community, so excited to have him do that. Nobody was upset on our end. Like, it took him a while. Okay, you got there. Yay. Love you. You know, but that damage. And then when the funding, I think sometimes there's challenges with funding from the government getting to health departments, which then hurts the agencies who then serve the clients and can't do it consistently. And the consistency is it. The consistency in having people use language that the community uses, trusting what the community is saying to you, believing their experience. They're the ones that need to lead what's going on and say, this is what we need. This is what we need. And you might, as somebody outside the community, think, well, that doesn't make a whole lot of sense. It does to that community. You know, and you follow whoever's most impacted with HIV. You follow them and believe them and trust them. And then if you're lucky, you get, over time, they trust you enough. Look, you know, my demographics are not a prioritized population, right? I'm a cis woman, I'm older, I'm white. But the community trusted me, you know, and they gave me grace, even though I didn't represent maybe populations most impacted, but I hired from that. I made sure those folks were trained as good as possible, and they had the impact on the community.
I think that, like, one thing that I've been having a lot of conversations about when I think about what you're talking about is the intentionality. You know, I think that a lot of the work, the effort you have put in, it's been intentional. You know, I think that what I can appreciate is that you are intentional in how you move spaces, but also how you move people in the work that we are a part of. You know,
Yeah.
I think that that has been something I've been in spaces where people have not been intentional with me, where it's been very tokenizing, where, you know, I'm very well spoken and I'm
Yeah.
Black, so people want to put me in the front of like their brochures and shit like that.
And you're
And
very cute.
I mean, it's all that, but I think that it's never been that way with you. And I think that even when I'm interacting with resources that are directed like through people, a lot of times I might just reach out to you like, do you know something about this? Because in my experience that I've had with just you is that you get answers. And that's so important because you are like, so, I am literally the person from a community, and like, I may be scared to reach out to a director or something like that, but it's having that connection to just people that means
Yeah.
something, you know? And I think that like
Yes.
a lot of times those people feel so far away. I think that it really does speak to the fact that you started in reception and that you still kept that, you know? I think that a lot of times people do lose that just people connection.
And it's the individual, like you're saying, it's the individual. I think systems forget that. And I know I've heard, you know, programs, they just want to count scopes. They just want to count
Scopes
numbers,
and
right?
deliverables.
And that's kind of it's a system we as a provider you're often in. But you get to do both if you're a good leader.
Yeah.
That you see those. I used to have a young African American kid who would come knock on the door at the center, at the admin door, because he knew he had access to me. And sometimes he grew up in DCFS. I never knew if he wanted a test or he was a writer. He wrote about his experience. Oftentimes we would sit in a room together and he would read me what he had written. And so I never quite knew. I'm like, and then when he was in trouble, which happened, he got assaulted, came to me, we took care of, made sure he was okay, everything, but he had access, and everybody knew it. That young kid, I drop everything when he comes, right? Like, so and that was what I tried to instill in my staff, that you have an incredibly important role to play. And if you don't show, you're a framing agent, because you have to reframe what our community has heard about ourselves. We're flaky, we're sex crazed, we spread disease, all we care about is clothes. You know, like all the negative messages that we've heard our whole lives, right, about who we are. And I said, you have to reframe that. You have to show that not only is that institution they're coming to, that institution is trustworthy, you're trustworthy, but also they are. Your community is trustworthy, because they don't even trust their own community folks, because that's what they've heard. Bad things about us, right? And so you think, well, that's a gay center. Can I trust them? You know, same with stigma. You know, stigma is huge and such a barrier. And the thing I worry about a lot is that people, you know, on the hookup apps, the dating apps, they'll say things. Oh, that person's not clean. That person's, and so that's stigma, right? I don't want to be with somebody who's HIV. And then if they come back later, HIV positive, all that stuff they put on somebody else is now, which is going to hurt them, right? They're going to be like, oh, now I'm the thing that I was, you know, and then they're not going to want to address their HIV status, because they're going to feel what they said to others inside now.
And they're going to think that others are going to say what they were saying to them. Yeah.
Yes.
That is such, I'm glad that you said that too, because I think that stigma is a huge part of like one of the issues I see with getting to zero. And it's not just like culturally, it is how we just view HIV. I think that there's been so much work with how we are working to prevent it and things like that, that sometimes we have just gotten in a space that we just don't uplift that there are healthy, happy people living with HIV. I think that since my seroconversion, I have been trying to really just put that image out there. I always say, and my funniest,
so important, Terry.
My funniest thing is I always tell people I found out I had hypertension before I had before I had HIV, and I promise you, I'm more worried about the hypertension than the HIV, because the HIV is definitely, I take a pill and I got to undetectable in a month.
Oh yeah.
I've been trying to deal with this hypertension for a year now, and it's still like it's the whole thing. But I think that like it speaks to how I think that I was a person on PrEP, and I believed it was 100%. However, I also understood that it wasn't. You know, I know that I take the flu shot every year and still get sick.
Yeah, so right.
I think that like it's been a lot of me understanding just information and how I receive it, but also how I am given information in my community and how I like send it out. I think that it's important to know my role in all of this too. I think that we as individuals fight stigma every day. The apps, for example, someone saying you're disease free and me reminding people HIV is not a disease. It is a virus that attacks the immune system, but it's not a disease. And I think that I say it in this space, like I say it in all other spaces, because again, you know, you might not live in a large city that has LGBTQ centers and I think that that's one thing that I also have started to like really appreciate and speak more on, like the plethora of differences that we have to go through versus just going to COH COH and then BYC when they were on Belmont and Broadway, you know? It's growing, you know, and I think that like that speaks to just community. It speaks to like there are people who want to grow their own spaces, but it's just really, really us in community who are those friendly faces. I know what it's like to have somebody who you just want to go and sit with because they make you feel safe. And like, you know, I'm only going to this space to see this one person. And if I don't see this one person, I'm not going to have the greatest day. That is so important. I think that's a part of it that a lot of times it's easy to forget in like the work and when you are running big agencies is that person, whether it is a senior citizen, whether it is a young person looking for resources, it's a person coming for testing, it's a person that's living with HIV, they are the core of who you are to exist. And I think it leads me to like my like final question, but final thoughts more so. When you think about getting to zero personally here in the state of Illinois, what are you excited about and what are some of your concerns?
I'm excited about the fact that so many people have been working on this.
Yeah.
Here nationally, but in Illinois, in Chicago, so many people have worked so hard and to make sure they're getting community input every step of the way. They did it with integrity. And it doesn't mean everything's right all the time, but it was so much concern and their understanding of the importance of everybody getting to zero together. The challenge to me is first of all our federal government, which seems to right now, well, not right now, but there's just one side that doesn't really want us to exist. And so that's difficult, and that those have real implications. And I think there's a part of the country, part of people that want to divide this community so that it's not a political block that has impact. They want it to fall apart and have us infight, you know, which is how you divide and conquer, right? And then they're in charge, and we who have the political clout, all of a sudden we're split. So I think we have to continue to remind each other that everybody wants to get to zero. The new focus has been to make sure that people living with HIV don't feel like somehow they're not part of it. Because I think in the beginning, the language wasn't as clear about, like, we're not saying we're going to forget about those people living with HIV. Like, that wouldn't happen. But the language wasn't so clear. So they made sure, like, this is about people not acquiring it anymore. It's not about somehow getting rid of or ignoring people who are living with HIV. And I think research is a really, really important thing of this. There's like the fact that you can get undetectable in a month, that's research. Right? One pill a day, research. I remember when people took 5 times a day, handfuls. They had to get up in the middle of the night, made them sick as heck. They had physical appearances because of the medicine. It was hideous. It was hideous. That's research. And there's wonderful research, the radar study at Northwestern, that for young people, they get $75.
I've been in radar for years. I think I started in radar when they were Crew 450.
See, you are the perfect person because you have been involved with research. You see the importance and you're willing. It's a bravery to me, which doesn't surprise me because you're extremely brave. But to go like, yeah, I'm going to participate because I want my community to do better. Most of the people, the researchers at Institute for Sexual and Gender Minority Health, they're LGBTQ identified. Like they're not outsiders looking at us saying there's something wrong with you, we're going to look at you. No, they just want things to be better for the community, their community. And they've learned tons about very local, like in young people, their substance use, what do their partnerships look like, what is their resiliency, what is their strengths. And it follows them. It's longitudinal, so it follows them over years, right?
I was going to say one, so I definitely know about radar, but I think radar is one of those studies that really speaks to understanding like the core of the community. I can speak to it just as a participant and understanding that I see the questions change in the language. I even the access to like, the ability to like, we want to look at body mass. We want to look at like your water weight. Like there's some things that I don't typically even get done at a doctor's appointment that is so important to me because even before I seroconverted, for me, it was understanding not just my sexual behavior, but also how can I be a part of the conversation when we talk about HIV prevention. And for me, that was providing all of my substance use information, my sexual history and behavior, my social networks and how engage with my spaces, because that does speak to it's so weird because like being in the work, you see how it speaks to, this is how they're going to design this grant for outreach. And, because they heard that going to the bars might not be the best thing. So now they're going to the balls and, they're going to actually pay the ball. And like, that's how they're going to get in. And that comes from research. That comes, and that comes from like
community input.
I think that like, I've been a part of some community participatory research even where I think that's a huge part of like even getting to zero is seeing community even participate in some of the research. One of the things I've loved to see, we have something at what the Center for HIV Elimination, it's called a Jump Intern, but it's a program where you can be somebody from the community. You'll learn all this work around research, difference between qualitative and quantitative data. And at the end of the internship, you're allowed to, I think there's a research presentation because in this internship, you also are producing and creating your own research question, which again, that's something, if I am somebody who is not college educated, but I can go into a agency and say, I've heard that I've conducted research. And
here's my paper, here's my presentation.
Even for me, when I first started out Howard Brown, that was something as a health educator that got me through the interview. They were very impressed at the fact that I had conducted research that was community participatory research around youth who age out. But with that being said, it got me through the door. People were interested and they wanted to know more. And I think that
happened to one of my staff. I involved him with that he got to do a poster with somebody at Northwestern. And he told me, he left, but he became a manager at another nonprofit. And he said one of the reasons was that was the research that he was involved in. They were really excited by that.
Yeah, and I still use that research on my resume. It's still like really important to me. I've done other research since then. And it's just really, really something that I always lean back on too, because I think that our community, for whatever reasons outside of just HIV research, we are heavily like observed. I think that because we are so like alternative, and it's not that.
But also we have a history because we lost everybody in the 80s and the early 90s. We have a history of understanding that science can save us because it when there was no science, people died, right? When nobody
And
understood. And I think our community, we take care of ourselves pretty dang well.
I was going to say that's something I never even appreciated, even in the idea, because, being born in 93, I can only appreciate the after effects, like the medication, the rapid testing, that was the spring of HIV I came into, the 15-minute oral quick test and things like that. And it was, I never have had to take an HIV test where I had to wait 2 weeks for a result. And that's
That's
a
the way it used to
real
be,
reality. And I think that when we have these conversations like this too, I think that it's also really important to understand there's been so much work that's been done that I think that, and I love you for this too, because I talk about this a lot, but you put it in perspective for me. And I'm going to tell this quick little story. We're on a Zoom call, and for whatever reason, I mentioned something about Sonora Halstead. When they first opened, they had their youth going through like the back doors or whatever. And I remember it was not even you calling me out or anything, but it was the idea of like, a lot of times when we start doing things, we don't have all the answers.
We don't know
Sometimes
what
we
we're
think that
doing.
we're doing a really great thing and we think that this is revolution, but it also isn't like the best. When in hindsight, you go back and like, oh, this is actually horrible.
Yeah.
I took that piece of advice for so many different ways that I used to look at, like resources, allocation, implementation, because I think that at the end of the day, this stuff is getting created because people in community are saying that like we need something, or
Right.
there's been a notice for a need, that it hasn't been filled. And I think what is important for us as community members to know is we have a voice in saying that like this works or it doesn't work. And it doesn't have to be super nice or tailored a certain way, but
Right.
even just your voice means something. And I think that like it was so important in that moment, even to just like hear that and understand the purpose was because we trying to get people through the door, because we want people to feel safe, because we want them to know that they have a like really, really comfortable
and
space.
They're protected. And it turned out not to work that way, but the impetus was
but think about how
good, but it didn't turn out that way.
How much we learned. Like I think that Senator Hostet learned a lot about young people and their interactions with young people, and just like
I personally loved when they stopped doing that because I got to see the young people more.
Exactly.
They hung out, and I'm like, oh my God, they're my babies.
Yeah, and I think that like that was one thing that like it made people feel like, oh, this is our space. We actually are welcome here. And I think that like
in the entire center,
and not just this one upstairs space.
Yeah, exactly.
I didn't, and it's a trial and error with a lot of this stuff, whether we talk about policy, whether we talk about the way we are choosing to create the initiative to get it to zero. It is literally trial and error. We are going to make people go up the back door and realize that that's not the best idea to do it.
And
then
now
we're
we
know,
too,
out.
We're not doing that again anywhere else.
And we learn from those mistakes. And I bring that up because I see it happening a lot in this work. And I want to say that because it can be scary. I think we live in a very scary political time. There's a lot of just scariness with just how people think and just how people spread messages of hate. But what I can also say is when I was 15 years old, there was only one LGBT space, well, two LGBT spaces that was known that young people felt comfortable and safe to go to. Now, I can say at 30, there is almost 10 plus, like, there's so many I can't even name of. Also, all the smaller groups that like rent out spaces to have like a drop-in space or something. Like pop-up drop-in spaces are a new thing. That is revolutionary. That speaks, in my opinion, that is like really cool because it talks about like we can possibly get there if we really invest in community in a way that like we talk about, like we understand and believe. I got one last question for you, and it's kind of like my question before, but just you personally, if Jill had to say that this is the one way, not because I know there's many, but this is the one way I think we can get to zero, what would it be?
Oh, that's good. It's probably not specific enough, but I think sometimes funders, with the best of intentions again, there's constraints. They have constraints. We have constraints. Then that person, there's constraints all the way up to the government saying you have to do these things, say these things, act this way,
Yeah.
be this thing, and it would be amazing to have like money that's not scope based or telling you what to do, and then you get people like you. Like I can name 10 friends that are visionaries and have great insight and connection to community, and then we create something where that we know is going to work, right? And we bring in young people and they're part of this group, but we're supported well, right? So that people can pay their rent and help, support their families. And then we get to say what that is. And to me, people need they need navigation. The world has gotten so complicated for all of us. Even if even when you work in something, you can't barely like I can't figure out how to interact with my medical people very well.
Right.
Like, and you need that extra help. I need a case manager. Like I need a navigator, to say, come on, let's go. I know you're thinking about this, but you need to think about this right now. I think that's really important. And I think investing in communities so that a thoughtful program or resource or something is built there and is impactful. They can exist. Like getting rid of evictions. Evictions ruin families for generations, right? Yeah. And I'm like, you just screwed that family for a long time because of this eviction. Yeah. It's terrible.
That is so
that
true.
Puts everybody at risk, for many different things, from depression, from having to do all sorts of things to make money, from,
it's
living in really unsafe areas because you can't
so many
get anything.
intersectionalities
Yes.
of it too, like so many layers too. I've thought about that, but not like in that depth, not that deeply. But yeah, that's so much. Yeah.
And these, the AIDS ACTG that's doing these cure on the path to cure, they're literally going to help get us to zero, right?
Right.
Because they're trying to extend so nobody has to keep taking a pill. And the longer that happens, so when people's lives get complicated, they're good. It could be, wouldn't it be amazing for a year you get a shot and a year you never have to think about your status except get your STDs tested, of course. But
right. And that's even amazing. I think that we're moving into a space where we went from having to take 20 pills a day to a shot a year.
Can you imagine? And you don't have to carry around anything. You don't have to worry about it. It's all sorts of things can happen. But it takes people like you who are who have invested in research and participated in research. That's where these answers are going to come from. I'm participating in research that my doctor wanted me to do because I was the perfect non-compliant. I was totally non-compliant on this thing she was trying to get me to do. And she's like, okay, join this research because you're not doing what I'm telling you to do. And let's find out more about that.
It's funny because I'm in the research with California about people who seroconvert,
Oh, good.
So that's like taking hair samples and like all this stuff, but I'm really excited about it.
Because it's a new acquisition and you were on PrEP. You were on long-acting injectable. That's so rare. I'm sure they want to study the heck out of you. Yeah,
I think that the most recent study that I read, or I don't know, it was on a call, but it was like in the studies that they did, they only had 6 people who seroconverted while on injectable PrEP. And I was
thinking, that's what I heard.
Yeah, and I was just thinking, this is out of a number of 2,600 something, and it was just so interesting to me, which is not why I did the research. I thought the research was just really interesting. Plus, I want more answers for myself.
Yeah.
But I think that it is really, really interesting, even because I think that it says more about where we are getting to zero also means that we have to answer some of these other questions
That's
about
right.
PrEP, and like it's not as just its effective rate, but also understanding what does the ineffective rate mean and what causes it, because I think that that's also important. It may be something we find out in a year, 10
At this
years.
point, they think it's because it's a virus that was acquired that was resistant already. So the person that had HIV, whatever their HIV status was, they had some resistance built into their virus already. And so,
Wow.
so the medicine that you were on, that person very likely already had a resistance to that. So,
Well, now you're just giving me more to read about.
Yeah.
Well, first of all, I want to thank you so much for coming and having this
Thank you for
conversation with
inviting
me.
me.
Jill, it's always a pleasure to talk to you. Whether it's you helping me out just in life or sitting to have this conversation, I am just honored to know somebody like you and to learn from somebody like you. I'm learning every day.
Yeah.
But yes, I want to thank you for being here. I want to thank everybody who joined us. I encourage you all to join us for our next week episode. We're going to be talking to another good friend of mine. You can let anyone know if you have any closing remarks or anything.
No, just I wish I knew my phone number, but I'm too new at it. Institute. Go on the website, Institute for Sexual and Gender Minority Health at Northwestern. And not only are there research opportunities, but there's open job positions. Now it's a university, so they're pretty picky about degrees.
Yeah.
But know that going in, but there's some amazing work, and there's some roles that are pretty good to put your foot in to see if you're interested. It's a wonderful place to work, and it's led by visionaries. So
yes, if you're interested, we'll make sure we add the information in the link below. But I want to thank everyone for joining us this week, and stay tuned for next week. As I always say, don't forget Journey to Zero, Part 3, the conversation will be out soon. So look forward for that. If you're looking for any information about that, you can visit journeytowardszero.org, where there's more information on the film, screenings, and our cast. Thank you all so much for joining us, and have a great one. Bye.
Bye, everybody.